The silent killer. Who will it kill next? Me? You? What is the silent killer? Most doctors refer to high blood pressure as the silent killer. And according to the American Heart Association, 45% of Americans suffer from high blood pressure. The reason this is called the silent killer is you could have limited physical symptoms and still be a victim. The American Heart Association categorizes blood pressure in 5 categories: normal, elevated, hypertension stage 1, hypertension stage 2, and a hypertension crisis. If you suffer from high blood pressure, it is important to know what category you fall into. Having high blood pressure can cause a lot of health problems. When your blood pressure is too high, it's beating too hard in your arteries and on your organs. And for long periods of time with it doing that, it can cause problems. It can cause those vessels to burst, those arteries to become weak, have weak walls, things that we do not want to happen. The Millions Heart Association states that high blood pressure can lead to heart disease and stroke, which are the top two causes of death in the United States. Let that sink in for a little bit. Your life can change dramatically if you do not take care of your high blood pressure. You can lose your vision. You can have failed kidneys, which in turn makes you rely on dialysis to survive. So one of the most important things to do when you do have high blood pressure is to take initiative and to monitor your blood pressure at home yourself. You can do this with buying a machine online, at a drugstore, or maybe through your doctor's office. When you do choose to find a machine that accurately fits you, it's very important that it's not too big and it's not too small, that it fits you very well. If you get one that is too big or too small, you could have false readings, and that's not going to help anyone. You need to have accurate readings. And also we do, as healthcare professionals, we do not want you to use a wrist monitor because those don't seem as accurate as the one that goes up on the upper arm and uses your brachial artery to tell you your blood pressure. This is really important, especially if you are starting on medication. So if you're starting on medication, it's important to take your home readings and make sure that the medication that you're given is being effective for your body. So when you're ready to take your blood pressure and you have your home machine, the most important thing is the placement of the cuff. So you're going to make sure that you're placing the cuff on the upper arm. You're going to read the cuff, and there is a spot that says artery marker, or there might be a picture indicating that's where they want you to put the cuff. So the artery marker will go right above the brachial artery, so the bend of the elbow. Once you have it on the right spot, you can tighten it. Don't tighten it too tight and don't leave it too loose. These are both reasons it can become inaccurate. You also are going to want to put your arm elevated but supported. So if you're sitting, a counter or a table would be sufficient enough, just so it's about level of the heart to get a good accurate reading. Once you start your machine, you'll feel tightness on your arm. That tightness will start to loosen up, and soon you'll feel the cuff release. When you feel the cuff release, the machine will give you 3 numbers. The first number you'll see is the top number, the systolic. The systolic blood pressure tells us when your blood is being injected into your arteries and with what pressure it's doing that. The diastolic, which is the bottom number, tells us how it is flowing through your arteries, how powerful it's flowing through your arteries between your heartbeats. The third number you'll see on there is your pulse. And a normal resting pulse should be between 60 and 100. So if that is inaccurate or is too low or too high, you're going to want to contact your doctor regarding your pulse. It's important to not keep rechecking your blood pressure either. This can also cause false readings. We get anxious about the readings we're receiving, so we're going to keep rechecking. And that's not always the best idea to do either, because we want that first reading is probably the most accurate reading. And if that reading is elevated, it's okay to check it maybe 30 minutes to an hour later. But rechecking it one time after another is not good. It'll be very inaccurate because we start working ourselves up. So lastly, not lastly, but if you feel your readings are too high or too low, off the spectrum, you should definitely contact your doctor. So let's talk about those readings. When do we get concerned? Okay, so according to the American Heart Association, a normal blood pressure is systolic, which is the top number, lower than 120. The bottom number, the diastolic, lower than 80. That's normal blood pressure. Elevated blood pressure would be considered between 120 and 129 on systolic. Diastolic, the bottom number, we would say under 80 would be elevated. Hypertension stage 1. If your numbers range on top, systolic 130 through 139. On the bottom, 80 through 89. Hypertension stage 2. Top, systolic, above 140. Bottom, diastolic, above 90. Lastly, hypertension crisis. Higher than 180 on top, systolic, and higher than 120 diastolic. So those are your categories that you're going to want to know which one you fall into. Normal or elevated blood pressure, typically the doctor will recommend diet and exercise. They're wanting to see lifestyle modifications. They might not start you on medication right away, but if they do get 3 consecutive elevated readings, they may consider medication. For hypertension stage 1 and 2, a medication would be initiated. Mostly if you're hypertension at stage 1, you maybe would be on 1 medication. As we go up into hypertension stage 2, you may be on more than 1 medications. And then right into hypertension crisis, I would say that you would definitely be on 2, maybe even 3 medications to help control your blood pressure. Regardless of what category you fall into, it's the utmost importance that you still do lifestyle modifications, diet, exercise, change what you're doing at home in your daily life. Exercise recommended is 5 days a week, at least 30 minutes. Get your heart pumping. You can walk. You can even break up that time into 2 15-minute intervals. Red flags. Things you need to know. If you have these red flags, you need to go to the ER. If your blood pressure is elevated and you're having a headache, blurred vision, chest pain, arm pain, numbness, tingling in any extremity, you need to go be seen. You need to call 911 or you need to call your doctor's office. Now, if you take your blood pressure and you're in a hypertension crisis, you definitely need to call 911. We are too educated on this subject to just sit back and allow our bodies to deteriorate. There's medications, there's classes, there's so much knowledge out there to help you reduce your blood pressure. There's no excuse for you to have high blood pressure and be aware and do nothing. The doctors will do their part, so please do yours.